Hi, my name's Mary. I'm just going to go ahead and prime some tubing, and I would provide hand hygiene, I would provide privacy, I would double check my patient's verification if he's allergic to anything. I'd go ahead and get my stuff set up. So this would normally have a cap that I would remove, and I would make sure that my tubing is closed before I hung anything. I would uncap this, and this would have a cap on it too, and I'd unhook it, and I would spike my solution. Oh, I would also check my solution for any, I'd check the expiration date. I would, of course, open it, check for the expiration date. I would look for if it's clear, if there's any holes. I would also check any medication that the patient is receiving to see if it's compatible. I would do all my medication checks before I gave any fluid. So I would go ahead and hang this up. And then I would go ahead and prime it. So I'd unhook the rolling clamp, and I would go ahead and prime my solution, and I would check for any air bubbles, and I would go ahead and fill the chamber halfway. It was already full, so that's why it worked, but if it wasn't, I would have filled the chamber halfway. And if there's any air bubbles, which there's not, because this has been used so many times, but yeah, and then I would recap my tubing and hang it up, so I'd be ready to roll. Knock, knock, knock. Hi, my name is Mary. I'm going to be your nurse. Today, can you give me your first and your last name? And if he's allergic to anything, I would provide hand hygiene and provide privacy. So we're going to go ahead and give you a medication today through your IV. I would go ahead and check the medication to see if it is compatible with the normal saline we're giving him. I would also check to see if there was any tears, there's anything leaking, the solution's clarity, and make sure that's all good. I would also check his IV site before we gave anything, and I would check for redness, for swelling. I would ask him if it's painful, if there's any irritation with it, and it looks good, so I'm not worried about that. So I would go ahead and unpackage my primary tubing, and I'm just going to take some of it, and then I would go ahead and undo the cap and spike the solution. Okay. And I would also make sure that my rolling clamp is closed. And I would pause this and make sure my normal saline is hanging lower than what my medication will be. And then I would go ahead and close and clean the port in which I'm going to use. I would remove the cap before I connected the tubing. And then I'm going to go ahead and back prime, so I would hang it lower and undo my clamp and just make sure everything gets primed. I would check the tubing for any air bubbles, and I don't see any, but if there was, I would go ahead and flick them out before I gave the medication. Then I would go ahead and set up my rate, so my secondary tubing, and we're going to give it 50 milliliters per 30 minutes, so 100 milliliters per hour, and we're going to go ahead and have it notify us at the full 50 to give out the full medication. I'm going to go ahead and run it, and then I would double make sure that I signed and dated the time and my initials when I gave the medication, as well as if there's a sign and date on my knock, knock, knock. Hi, my name's Mary. I'm going to be your nurse today. And I would confirm the patient's identity twice. I'd ask them if they have any allergies. I'd provide privacy, and I would go ahead and wash my hands. And I would ask them, have you ever had an IV before? And they said, yeah. And I asked them if they have a preference for an arm, if they had any questions or concerns, and I would answer any questions that they had. So I'm going to go ahead and just get set up for a second. And so get all my supplies set up. I'd go ahead and just label my Tegaderm, the little transparent one. Okay. So I would go ahead and apply the tourniquet. And I would ask them if they had like a preference, and they would say like, oh yeah, my right arm. And I would go ahead and apply my tourniquet, and I would check the veins. If they didn't have a preference of which arm, I would go ahead and check both arms just to see what my options are. And I can feel that this is a good vein, so I'm going to go ahead and go with this one. So I'd release my tourniquet. And go ahead and clean the area for the full 15 seconds. I'm going to go ahead and dispose of that. And then I go ahead and rewash my hands and get gloves. And go ahead and reapply my tourniquet. If this patient was in a bed, I'd obviously go ahead and raise the bed to an area where I'm comfortable, but for this purpose I'm just kind of bending over because it's a table. Okay, so I go ahead and feel for my vein, and I would go ahead and insert it. I'd pull back and insert it bevel side up, and I would go ahead and I would see blood return right here, so I would know that I was in. So I'd go ahead and advance the catheter. Go ahead and have gauze. So I would already have that cap undone, and I would go ahead and secure it. If there was like a cap, I would go ahead and have the cap ready. Yeah, I would already have that undone, so I didn't have so much blood coming out everywhere. So I'd go ahead and flush the IV for patency. And see that we're in. So I'd go ahead and take my tape and secure the catheter. And then go take my other tape. And if my tape was long enough, I could do the whole U-tape thing. where I wrap the tape around it. Before I inserted that into, I would go ahead and bead it just to make sure that there's absolutely no air bubbles. Go ahead and apply my tag down. And I'd want to do it above the site just so I can double check the site, and I would go ahead and assess it just to make sure there's no infiltration, there's no swelling. And I'd go ahead and dispose of my waste. I would go ahead and document my IV site, so it was on the right lower forearm. I would document if there was any problems, if I had to retry the IV like numerous times. I would assess the site, I would document if there's any redness, any swelling, really any concerns that I had with IV. And I'd go ahead and I would already have my solution primed. It would already be ready to go, and then I could go ahead and connect my tubing to administer fluids. And I would dispose of the waste. Hi, I'm sorry. I just wanted to insert like this little extra into my video. I just wanted to bring up like two concerns I had. Of course, I realized when I was inserting my catheter, after I advanced my catheter, I just took the needle out and set it on the side, and I realized that's a big no-no, and I'm sorry, I don't know why I did it. I don't know if I just got caught up in the moment or what, but I know it's no excuse, and I just wanted to clarify that. What I would have done is, of course, after I stuck the needle in and advanced the catheter, I would have taken the needle out and just automatically stuck it in the sharps container. I know that I didn't, and I'm really sorry. I know that I should have, and there's no excuse. I know it's a huge safety hazard, so just always remember, after you take your needle out, just stick it in the sharps container. So I'm sorry, I just wanted to clarify that. And I also wanted to say that my video got cut off a few seconds at the end. I'm not sure why, but I just wanted to say, I was just clarifying that after the procedure I would dispose of any waste that I had. I would, of course, do hand hygiene. I would make sure my patient didn't need any other assistance for anything. I would make sure the bed was in the lowest position, make sure the collight's in place. And yeah, and I would also document my IV site, or document my inserting my IV, and I would include things such as where it was, the location, how many attempts it took, the gauge of the needle, maybe the type that was used. Yeah, and I would also, every time I went into the room, I would also assess the IV site for any complications such as phlebitis and infiltration, any infection, yeah, anything like if it's swelling, red, inflamed, you know, if there's any, I would ask the patient if it was really painful, really bothersome. Yeah, I just wanted to clarify those two things real quick. I'm really sorry. I know that I should always stick my needles in the sharps container or activate any like safety device that the needle has, and I realized that I didn't do that in my video, but I know I should have. So sorry. Thank you guys for watching.